Hello guys, I just finished my appointment and my first gum laser gum treatment from my periodontist. Um, it's gonna be here, this side here. Actually, the numb part is already it's already gone, so that's why I can speak and I can move already. So as you know, if you followed me before, I had a deep cleaning from my dentist prior to that. Um, but this one is a periodontist, so it's for the gum specialization. So it's also the problem with my teeth because my teeth moves around. It's because of gum problem. Um, my dentist said it's not because you don't clean your teeth, because I have a good teeth. He said it's just that the gum is the problem. It means that it's either it's the genes or history of my family. So I went to the periodontist today, and it's my first appointment. Um, so they're gonna do it here, which is they did today, and the next 2 weeks from now or 3 weeks from now, it's gonna be here, here, and here. So it's gonna be four procedure. So what nice about my periodontist is I didn't feel any pain when they numbed me. It's you will not they will not gonna put you to sleep. They're gonna give you anesthesia. They're gonna inject in this side here. I don't know how many times he injected because I didn't feel it. He has this certain machine, which is I will post the video, how it looks like, and it makes you you will not feel it because the machine will detect the pain um, or the area that you will not gonna feel really. It's not like my other with my dentist before that she injected um, for my deep cleaning here in the buccal, and that's really so painful. Actually, it teared me up before. If you saw the video a long time ago. But this one, no. So it was really good and I didn't feel it. Just now I feel like um sore, like you feel like your gum is swollen. So drinking cold will help. And of course you're not allowed to eat certain food for weeks because you don't wanna um have a will cause problem, and that's especially hard food. But so far so good. It's just that after when the anesthesia goes down already, it's just like your head is just like pounding. But the pain in terms of when while they're doing it, it's not painful at all. Again, it depends probably where you're going or who's your dentist or periodontist. So far so good. So here is after they injected the anesthesia is in the right upper gum, and it's really numb, and they gave me this suction, so we're taking a break before they start the laser treatment. So while on break, so they just gave me this suction for to help me out to suction my saliva. Now here's the office, and you will see that's the anesthesia that they used. It's very cool because it will detect the level of the pain of the patient. Now this is the laser treatment. That's the one that they used. So this is after the procedure. As you see, it's swollen and there's some residue of the blood. I didn't feel any pain while the procedure. Hello guys, good morning. So today is the first day after my laser gum surgery. So here it is. See, it's bruised and there's a lot of blood clot there. Yes, it is uncomfortable because you feel so weak. So I was teaching class today, and I just put down my weights because I just can't. I just end up dictating because it's the pressure on my head. It was swollen and it's like my head is pounding. But this morning it's not it doesn't pound my head as much, but it's just still swollen. So my face is swollen. To be honest, I don't know if you can see, if you can tell, because even my client can tell that my face was swollen. So yeah, I'm just giving you an update, guys. But anyway, yeah, it's not a joke. I'm looking forward for the next three. Hello, guys. This is the third day after my gum surgery, periodontal disease surgery. Okay, this is the update. There you go. Okay, so the swelling and the soreness went down. It's not as the other days. I still can't eat on this other side here. I'm avoiding, because I cannot brush on that side. I'm just doing the rinsing, the medical rinse. So it's gonna take 10 days await for me can brush that again. A soft brush or a little bit or electric brush. Just slowly brushing it. That's what they told me to do. Also, eating wise, I can just eat soft food or smoothie if I want to eat on that side. But I want to just make sure, so I'm just eating all the way on the left. I don't want to touch anything there.
Third week, and my next appointment will be this coming Tuesday, June 6th. It's not swelling anymore. The swelling went down. It's healed, okay? The disadvantage only of this is if you have a crown or a fake teeth. Because when they do that laser thing on your gum, like a deep cleaning, it recedes the gum. It means the swells goes down. It means your gum receded, and that's the disadvantage of it. That's what my periodontal told me when I called. If you have a real teeth, it's good, very amazing, and it makes your teeth much longer because your gum goes down and recedes, so it's much more longer looking and prettier. But if it's fake teeth, then it's kind of ugly. Was during my surgery, okay? So if you see, this is a fake tooth. This two here is fake, and even the back one is fake. So that's a crown, 3 crowns. And if you see this gum here in the center, it's all the way down, right? Even on this one, the gum is all the way down, covering the teeth. So after the surgery, I noticed the gum receded, so it put gaps on my gum and teeth. It looks like my crown didn't fit well on my teeth because there's a gap. See this? See? A gap and a gap. So I don't know what they're gonna advise about it on the Tuesday when I come for my lower teeth procedure. If I should get another set of crown, but this crown here is still new. I just had that last year, and it's not cheap. It's expensive. And of course, I'm upcoming to do brace. So I'm not sure if I should just wait till the brace or not, or maybe they can do another cosmetics just to cover up, the gap. It's just so ugly, guys. I mean, I don't know. Some people say, it's not obvious, Angel, but for me, it's obvious because, I'm looking at it every day. And, when you smile with your clients and, they see that gap there, and it looks like rotting teeth because it's color black, because it's gap. And it's just stressing me because it's so expensive. New set of crowns if I ever gonna get it. Brace, and plus this laser here is also thousands of dollars. So it's just stressful. I just hope that this coming Tuesday, they can give me a good news or something, options about it. Hello guys, today it's gonna be my periodontal procedure again, for the second time. This time gonna be in the lower right. So before the procedure starts, here's my feet, lower. So they're just gonna dig in on that. They're gonna clean that laser. Good luck. All right, guys, I'm numb already now. I'm numb on this side now, so I cannot feel. So that's the injection again. All right. Hello, guys, back in the car now. The procedure for an hour and a half only. So here it is, here in the lower. So it's kind of like pounding. It's not painful, but it's just pounding and it's uncomfortable. So if you watch the part one of my laser gum surgery, the whole process of it, I just want to go over with it again. While they're doing that laser thing, you'll feel the burn. You feel the burn because it's kind of warm, and smell the burn. Also, he did some deep cleaning inside. Again, you won't feel anything. I can compare it when, women can relate to this. When you clean your nail, when you go to salon and deep clean on your nail because maybe ingrown or, a grown nail inside it, and then you try to dig in. That's how it feels. So I'll be back again on the June 20th for the other side. It's either going to be upper or lower for the left side. So they didn't give me another prescription and refill for antibiotic, because they said they don't do that for the second time, only for the first time, because there's going to be still remaining effect on it. only for the rinse, but still I still have it at home. I don't have to buy another one. For the anti-pain medication, I just prefer Tylenol or simple stuff because the one that they gave me last time, it feels weird, so I will not gonna take that. Again, it's not painful, it's just uncomfortable, like you feel like there's something in your teeth and like, it's just uncomfortable. But anyhow, you can drive yourself, I can drive myself, and I'm gonna go head home now and lay down and sleep. Anyway, here it is again, guys. Here you go. Deep cleaning, laser, gum surgery. Hello guys, I just want to give you a quick update with regards to my second gum surgery yesterday. So yesterday I did the lower part of my teeth, the right. So here it is now. See, there's a lot of blood clot and bruising. So I didn't take any numbness or any pain medicine. I just took antibiotic for, rinsing, gargle. I cannot brush there yet or eat on that area. So for me, it's not painful. It's just like weird feeling and uncomfortable, but otherwise, no issue. So I still have two more procedure here and here, and that's it. Hello guys, it's been 2 weeks since my second gum surgery, laser gum surgery for periodontal disease on my lower teeth. So the first one is the upper right, and then it was the lower right. So here's the update. Okay. So as you see, same as the upper side, it receded, the gum receded. So that's the disadvantage in gum surgery or laser because the gum receded. Also, it makes your teeth a little yellow because you cannot brush in that area. You cannot take care on that area because you have to rest it for 2 weeks before you can brush again. For me, it healed quicker than the upper because again, the upper has crowns, lower are all natural teeth. But still, it's not yet 100% healed. So for sure, I'm expecting gums will recede more for a few days from now. Now, I'm here on my third surgery or gum surgery. This time will be on the left. I don't know where they're going to do, upper or lower. I'm going to update you later after the procedure. So I'm going in now for the third procedure and I'm going to be back later to update you guys. Getting ready now and they're going to do the upper left this time. So I'm already numb right now, guys. So this is after injecting the anesthesia. This time it's so weird. The third time, it's kind of, I felt it. It's kind of painful. It's not like the first time and the second time. And feels like they injected longer this time. So after 1 hour and a half, it's done. It's already done the procedure for the upper left. After the laser, he also did some deep cleaning as well. So as you see, there's some blood clots there. Also, he followed up cleaning the other teeth. So I'm back in my car now, guys. And yeah, the numb already receded. It's not as numb as before. Anyway, I noticed myself the numb for me or anesthesia recedes quicker. Other people don't, but it's just my mother said that she's like that as well. I felt more rougher at this third time rather than the first and the second. Actually, the first I was not feeling anything at all. But this time, the upper left is much more for me intense. Also, aside from that, he went back through upper and lower. He cleans more, follow up cleaning. And when the anesthesia receded already on me, I felt already some, when he does deep there. So I'll feel it really. So it's really kind of painful. It's tolerable. I have a high pain tolerance, but still I feel it. My next appointment for the lower, which is the last one, is going to be on July 19th. And afterwards and that is going to be follow-up checkup again to go back and clean everything and check up if everything is okay. So I'm going to follow up you tomorrow, guys, on how I feel and how it goes. So I'm going to go home now and rest. Hi, thanks for this question. To be honest, it depends on the area that you just had it or how sensitive the teeth was or how big was the problem in a certain area. So as of now, I already had three. I only have one more left, but based on the 3 sessions I done, the other one that has a crown takes time to heal. The rest like this, this, the clot or the scabs goes away probably around 2 days. That's what I noticed. And some might take more, but because the process, it takes time in a way that in a long days pass, the gum recedes. So even the scabs or clot goes, you'll notice your gum still healing and starts to recede. It's been 4 weeks since I've done this, okay, because of the scheduling. They cannot find a schedule for me, so it's like 4 weeks gap. Usually it's just 2 weeks or 3 weeks maybe but this time it's 4 weeks, almost it's a month. Now today I'm gonna do the last procedure, which is the lower left. So before going to the periodontal dentist today, then I'm gonna update you first how I felt the next day on the third procedure, or the upper left. For me, the upper left healed quicker than the rest that I experienced on the right side. And I don't know why, but during the procedure I felt more sensitivity and pain here while doing it. Whereas the first and second, I didn't feel anything at all. So I was just like very comfortable going, and all the procedure was for me is just like nothing. Compare on the left upper, I felt pain, or like, I don't know. Probably you can ask additional anesthesia or numbing, but I didn't ask excess. But I just but you know it's manageable and stuff like that. But again, this is the one I never felt any headache. Then after the procedure, when the anesthesia receded, I never felt headache. Now for the gum, so it's this is the one now. So they did from here going here. So as you notice, there's a gap here now. So it's because of the gum receded as well, just like the other ones. So now I'm gonna do the left. So again, guys, as what I've said, this one healed quicker, and it's like I ate immediately there the following day or second day later. But let's see how it goes on the lower left. Hello, guys, I'm done. Okay, this is the fourth and the last laser procedure, and thank God I'm done. But of course, I have to keep coming back every 3 months. Once you have a periodontal issues already, you need to keep coming back every 3 months for them to check it out. However, here it is, still swollen. See? So this is me, guys. After the anesthesia, I'm so numb. And of course, it's bleeding because it's injected how many times on the lower left. So from the front till the back of my lower left was injected with anesthesia. So of course, I cannot feel anything. And of course, as you all know, I've already told you before, I have a tendency that anesthesia goes so quick on me. Like after a few minutes, maybe an hour, 50 minutes, anesthesia recedes already, and kind of I feel stuffs. But I have a high pain tolerance. Of course, again, I will tell you that when they do the laser, you will feel like a burn, because it's kind of like, it's laser, it's burning something inside the cavities inside your gums that's seated there for a long time. Now this time, guys, the lower left, I didn't feel anything. It's kind of, I'm just kind of relaxed, to be honest, on the clinic while laying down, compared to the upper right, because as what they said, every part has tendency that is the pain is much than the other side, because some has really like tender there, or harder. So that's why you feel more. But again, maybe it depends on the person. I don't know. But of course, now I'm feeling more the pounding after now the procedure, compared to the upper left last time. The procedure, during the injection, during the process, I'm feeling it. Kind of feel it and kind of painful. But after the procedure, I'm feeling so relaxed and okay, and it seems like nothing. But now, here on the left lower, during the procedure, I don't feel anything. But after now, I'm feeling kind of pounding. So I took already 2 Tylenol. They gave me one. They gave me two. So yes, I'm done for all the procedure for the laser. However, I need to go back 2 weeks from now for a checkup to see the numbers, means like how deep it is, or if my gums are healing right. Then after that, I'll come back for regular checkup and cleaning, just a regular one, every 3 months. Regular dentist, you come back every 6 months. For perio, you need to come back every 3 months. So let's see how many insurance will cover. But what to do? I need to do that. Anyway, so after this, they said I can go already for the to the ortho for the brace. But I told them that I need to relax first and come down and take a break from this dental work, because I'm tired. Hello, guys, welcome again. And today is the first day after my last laser gum surgery. So usually at night when I'm resting, I don't feel anything. But last night it was so weird, like it's like really pounding. And usually, it never happened to the to the 3 sessions. But last night, it was just pounding. But it's not like hurt, but it's just uncomfortable. Like I always like doing that because, and even after I rinsed the antibiotic already and stuff like that. But anyway, I just took a Tylenol last night to ease it. Um, But this morning, it's still pounding, but it's not bad. It's manageable. Again, it's manageable. Okay. Now this one is the when I checked in the mirror, this is the one that has really a lot of blood clot and it looks so bad. Like ew. Like look. See? So there's a lot of residue and blood clot and so good thing when I smile, it doesn't show. It doesn't like my lower teeth doesn't show. So, but anyway, I'm just sharing to you guys how I feel today and looking forward that it's already get cleaned up there because it's kind of disgusting. It's swollen, to be honest. It's not like the upper right, the upper left. Like the next day is just like nothing for me. But this one is like now I cannot. When I do that, I feel like there's something stuck there. You know, it's when I touch it through my gums, it's through my tongue. It's just like swollen, or it's not painful or uncomfortable if I touch it, but I can feel that the gum is swollen and sore. Like even my face is sore and swollen here. But anyway, I'm glad that it's over, and I still have the following checkup upcoming up for them to check how it is and the numbers of my gums. But anyway, I'm gonna update you. Hello guys, it's Sunday here, and I just want to be lazy and just resting and laying down. Anyway, so this is the part 11 and update from fourth gum surgery. This is 4 days later. I know I uploaded my video late, but I did my last gum surgery, the fourth procedure, which is the lower left here on Wednesday afternoon. So today is Sunday. So this is the fourth day. Now, before I show it to you, okay, 'cause it's kind of disgusting to be honest. This never happened on the first, second, and third. However, the first, because I had a crown there, it took more time to heal, and some clotting and white dead skin from the gums stayed longer, and like when a wound is healing and something like that, but it's not too much that like this. Okay, now the lower left, this is real teeth. I don't have um any fake teeth there or whatever. So this is kind of weird that it did like this, because the other teeth, the normal ones here, this and this, kind of like it didn't did that. Like it healed not immediately, but it never shown like this. Okay, so I'll show it to you. See inside. So again, the procedure was from here to the back. Okay, center to the back. This one, it's kind of like I don't know what's going on, and I feel like I cannot move my chin, a jaw on the left side. Like if I do this, like here is like sore or uncomfortable. If I touch it in my tongue or I touch it in my fingers, press, it's not hurting, but it's just tender. But with tongue, it's not. Only when I press it. But yeah, it's just weird. I researched in Google, but it didn't say that it's infected or whatever, and there's no discharges. It's not bleeding too. So for now, I'll just use the antibiotic rinse that they prescribed. Anyway, I'll just update you more in the following days. Now, worst comes to worst, if it won't get better soon, I'll just call my periodontist and ask what's happening. Anyway, I have a follow-up checkup with them on August 1, and so we will see what happens. Hello guys, this is part 12 update. It's been 2 weeks since my last periodontal procedure, laser surgery on the lower left. Okay, that's the last one. I had a 4, okay, for those who haven't known. Now today I came back for a checkup, follow-up checkup, also for a polishing. Means like, because the rinse, the medication rinse that they gave me will make your teeth discolored or like yellowish. So they came, they cleaned it up or polished it. But first, I'm gonna show you the last time, because I show you that it's the lower left. It's kind of like the gum is like disgusting, like the discoloration, because it's normal, but now it's better. See, it's gone. So, but my gum on this side here is still sore, so it's sensitive today when they were cleaning it or they were polishing it, because it's been still 2 weeks since then and it's still sensitive. Anyway, so after they polished, your teeth is my teeth is way whiter. So usually there's a yellowish there on the bottom. So yeah. So they suggested a lot of steps for me need to do, so that to avoid the yellowish, and also for the rinse, they said I still have to use it for this part here. So just use a Q-tip or cotton to put in a sensitive area, which this one lower left, but do not rinse all over my teeth to avoid the discoloration of everything. And anyway, I'll be back again by November 21st for the cleaning, and to check my gums number, how, if it's healing right, or if it's if it's in good condition. And I'm the bone loss is getting better. Guys, I'm back now at periodontist, but this time they're just gonna check and clean my teeth, because I have to go back here every 3 months. So it's been, I guess, 4 months since I got here from my last periodontal disease procedure. So now I'm back, and let's see what will they say. Anyway, wish me luck. All right, guys, back in my car now. So, um, the way they clean this is my first time cleaning in periodontist after the whole procedures, of the 4 procedures of periodontal disease surgery. Okay. So now what they did is just she cleaned my teeth. Of course, she said it's normal to have a sensitivity, especially in the front teeth, after that kind of procedure, because of course the gum receded, and much sensitive part of the teeth will be there and exposed. So what she did is she put a little numb cream to help it out, but it's just like when it's sensitive, it's suddenly like you get a jerk, because when especially the cold water or that blower hits it, it's kind of like, it's not painful, but it's just so sensitive. And yeah, she cleaned from side, front, back. She's very thorough with it, in fairness to her, and she has really light hand and very, very good. Yeah, she advised me a lot of stuffs. Get more paste, not the gel, toothpaste with sensitivity. Avoid the whitening part of the mixture of any toothpaste. Just pure sensitive teeth, because, and then don't rinse it at night. So leave it there, sit, because it will help to coat the enamel, and so that to avoid the sensitivity. Of course, she advised I recommended Sensodyne, which is that's what I'm using. But again, I'm used to rinsing my teeth every night. So it's just that it won't. So she said not to rinse. And then the periodontist, Dr. Davis, came in and checked my teeth, and he said so far it's so good. And then yes, so he said that if I'm gonna go ahead to get to my orthodontist for my brace, I can go. And I said I might just go next year, because this year is just too much dentist appointment for me, and I'm so stressed out. And they laughed, because yeah, it's a hard, not a hard procedure, but it's kind of like a stressful procedure, especially during the periodontal surgery. So 4 procedures, and it's kind of, also it's expensive. But anyway, guys, yeah, so I'll be back on April here for another procedure, cleaning. So basically, when you have this issue, you have to come back with them, or cleaning your teeth every 3 months. So it's either you stay with your periodontist, so that it's them to clean your teeth, or you go back and forth periodontist, and with your regular dentist, periodontist, regular dentist. But with me, I will stick to with my periodontist, because they know better everything with this kind of situation, and they have a very, very light hand. I don't want to go to the other dentist, because the one who cleans the teeth is so have a rough hand. So I don't want to go there, especially with my situation that I have a very sensitive teeth. So yeah. Anyway, at least here they're used to with sensitive teeth and stuff like that. So periodontist staff, so they know how to manipulate it, and they know how to control the sensitivity while they're cleaning your teeth. So it's really, really good. All right, guys. So I'm gonna update this situation again after I guess April, because that's my next schedule. Hello guys, I'm at work right now. I'm just gonna do a quick recap and quick update on my laser gum surgery. Last week of April, I had 4 months later after the whole procedure is done. So it was like a cleaning procedure. So last week I came back for another cleaning procedure. It was 4 months later. Okay, so I was just gonna give you before and after. So this three teeth here is crown. Okay, so as you see, my gum is all the way to the teeth. So that is before the surgery on that area. So after the procedure, you'll see there's a gap. There's a receded gap. So this procedure was on the update part 5 that I did, if you want to go back to that. So if a quick recap on that. So when you have a fake teeth, whether it's fake or not, the gum recedes. So when you do a laser gum surgery, of course, they do a deep cleaning with a laser, so the gum burns and recedes go up. So if you have a fake teeth, there's a tendency it's not going to fill in the whole thick gum thing. So you might need a different procedure later if you want to make it clearer, like another crown or a graft gum. So you can do that later when you have a when you just have to talk to your dentist about that. Now they said that with that gap, it's not sure how if it go back down or not. Usually they say it will not go down, but I'm going to show you what is it right now after few months later of the procedure. Okay, so see, there's a gap, but it's not as gappy as it was after a few days after the surgery or a month after the procedure. But sometimes it fills in, sometimes not. So it's gonna go on it, up and down, up and down. But it's not bothering me. It's not, the thing is that an annoying part is when you clean your teeth, when you after eating, of course there's some particles goes in, and I always have to carry all the time cleaning floss. Toothpick is bad. Okay, floss. Anyway, so so when I came last week, it's for the cleaning. So when you had already that gum problem, laser gum surgery or periodontal procedure, your teeth is very sensitive. Last procedure before last week, where I came back to, that was part 12. When I went back for a checkup after all the procedures, my teeth is so sensitive that it's kind of like bothering me, like it's when every time the spray, the cold one touches the teeth, I was like, it's not painful, but it's just so sensitive. So of course, guys, as you know, that teeth will be sensitive when you have that procedure, laser gum surgery. So expect it, give yourself maybe a month before your teeth recovers. So when you go back for after 2 weeks of checkup after your procedure, when they do cleaning and checkup, expect it's gonna be sensitive. But as what they said and told me before, just applying and keep using the toothpaste that is for sensitivity, and then so that it gets better, and just leave the toothpaste unrinsed when you're done. It will just go better. So last week, the girl that do my teeth was very observant. That's what good about periodontists. They are very professional. They know what they're doing, and they know how sensitive the teeth will be. So she was very careful, but she even asked me if I want a numbing, and I said no, I think I can handle it. So good thing I was not sensitive, and good thing it was okay last week. So I able to handle everything procedure. So it varies to every person. Some people has a very good tolerance, like me. Some don't. Okay, but last week it didn't really bother me. And she did the deep cleaning, and she even no, sorry, not deep, she just did the cleaning, recap, and check how the numbers, because like when they check the number of the gums, how deep your gum pocket is, so that's how they base if your gum pocket is got better or not. Like mine, when they check, is on the right, like on number 2, 2, 2, 2, 2, 3, 2, 2, 3, 2, 2. So they said if that's the number, it's better, because last time before my procedure it was 5, 6, 5, 6, 4. It was deep pocket. It was bad. It means that there's a tendency your teeth will fall off, okay, because of your bone loss. So this time it was better. It was 2, 3, 2, 3. The only time that it says 5 and 6 is the very back side, and I was worried when I heard it, and the lady said no, don't worry about it, because at the back teeth there, it's always going to be like that, because it's always a lot of it's much gummy at the back side, and it's much more tendency when it's much gummy at the back side, and it's much more what do you call the exact term? It's much more deeper pocket, so it's normal, she said. The important is in the front. Okay, so it was good. It was very good experience at that moment. I just want to update you guys after a year when I had my laser gum surgery procedure for my periodontal disease. Okay, so last year, the last update on that was this one was like, this year, May 2024. But I'm gonna show you a picture for before and after. All right, guys, see that? There's a gap, and gap, yeah. So because the gum went up, receded, and it's so ugly. I was so upset because it just made me so conscious. And I remember I asked the assistant at that time of the doctor, asking if that will change, if the gum goes down. And according even in Google, it even says that it will drop down a little bit as just a hairline, but not really gonna cover everything. So I was really upset about it. But in my mind, I mean, they also suggested, well, if you're going to the brace anyway for your ortho, it will also fix that anyway. So now today is the update. 1 year later, this is May 2023. That what happened, you know, after the surgery. Now today, see, it closed. Compare. Now, but this teeth is already, this one is so all the way back. Now this one is this one. Okay, if you notice, it moved. And my overbite is not as overbite here because of the brace. So it really helped, you know, with the brace, and it changed a lot. And also, based on my orthodontist, still have a long way to go on my brace because that's also gonna put at the bottom. So it will take almost 3 years for my teeth to finish. And also, they might change the crown, but they're not sure. It depends. If they can manage to move it around, that I don't have to go to my regular dentist to put a new crown, that would be great because I don't want to spend money for that. That's a lot of money for a crown, which is still, this is still kind of new, you know. Anyway, so keep in mind, nowadays, I always go to my periodontist for a cleaning purpose, because I don't go anymore on my regular dentist for cleaning reason, because periodontist knows better how to touch my gum, how to touch my teeth, because again, sensitivity is already there since the gum receded or since I did the laser gum surgery. It's not painful, but it's just sensitive, you know. So there are certain spot that you will like you jerk because you like there's the nerve, you know. So I don't go to the dentist, the regular dentist. It's good because they better to clean it with my brace already. So far, it was not easy journey, especially if you are very sensitive with your teeth. But it's worth it. It's worth it, okay? Don't be scared going to periodontist to have a laser gum surgery because it's not that bad at all. Especially now, there's a lot of equipment already available that to help you out with your journey. It's not like long time ago that it's not high tech yet, you know. But now it's very, very good. Anyway, so that's my update, guys. That's my update for whatever. But also, after a year, of course, I never had an issue with my teeth. I don't have bleeding anymore. I don't have bone loss. So far, my numbers are very, very good. The teeth is really sitting well on my gums. Anyway, for you guys are wondering, no, when you have a bone loss or periodontal disease, that doesn't mean because you're not cleaning or what, you know, not taking care of yourself, you don't have a hygiene. Not like that. That's not the case all the time. Sometimes yes, sometimes don't. In my case, the doctor said that it's because of my genes, my parents, our family is like that, that's true because we have gappy teeth, and then it starts to, bone loss and recedes, but all the stuff, it's the genes, okay? So anyway, don't be embarrassed, guys. It has nothing to do with if you're cleaning or not, So it's either the two. You're not cleaning or it's the genes. That's just how you are, okay? But anyway, thanks for watching, guys. And I don't know when I'll do update again for this journey because I'm already done. Now my journey now is the braces. So this is my 4th month in brace, which is I already saw a lot of changes. As you see on the picture, it moved already, and I'm not as overbite as before, which I'm very, very happy. It's worth it. Okay. Right, so anyway, guys, thank you again for watching. Have a great day.